Okay, so what I'm going to talk today is basically, first of all, why we would use ICA to clean our data, how to do it, so how the ICA-based cleaning works, and then I'm going to focus on the most crucial bit of ICA cleaning, which is how to perform component classification, both on the theoretical point of view and then for some practical examples, hands-on on what is signal and what is noise extracted from ICA. Then I'm going to touch upon automated approaches to do ICA-based cleaning and explain a bit of the factors that can impact the characteristic of the components and show you a couple of examples of the effect of ICA-based cleaning. So why should we use ICA to clean fMRI? The good thing about it is that it's data-driven. So unfortunately, if we don't have external recording or if we don't want to use any strong prior, any region of interest, this is very good because it's just data-driven. We just decompose the data into set of time series and spatial maps, and some of them will be related to signal, some of them will be related to noise. Another good thing is that in this way, we can capture different sources of noise, motion-related, physiological noise, scanner-related. And also, because it's data-driven, it's subject-specific. So we will take out and we will separate for each subject its own specific signal and noise components. However, problem is that because it's data-driven, nobody's going to tell us, or at least the ICA algorithm itself is not going to tell us which component is signal and which is noise. And especially among the noise components, it's not going to tell us exactly which noise source we are talking about. And because it's subject-specific, we are going to end up with quite a heterogeneous sample of components. So the ICA algorithm itself is not going to clean our data. So the ICA-based cleaning procedure is mainly made up of 3 steps. One is our actual ICA algorithm decomposition. So from our pre-processed fMRI data, we split it into a set of components, time series and spatial maps. Then we need to classify them into signal and noise. And then, as we saw in the introduction, we will remove the noise components out of the data, usually within a GLM framework in an aggressive or non-aggressive way. So because there are many, many approaches to do that, and they mainly differ in their second step, in the way that different approaches will classify the components into signal and noise. And that's what I'm going to focus on now. So how do we perform component classifications? Well, the literature is very, very varied, and there's a lot of approaches. So let's have a look at some papers. OK, first of all, manual classification. An expert manually classifies the components and says what is signal and what is noise. This is time-consuming, subjective, because it's a person deciding what is signal and what is noise. So we want something automatic. We all agree on that. OK, so there are 2 main groups of automatic algorithms. Some of them are semi-automated, and some of them are fully automated. For the semi-automated ones, most of them require a training data set, which means that someone needs to manually classify the components. It's still less data with respect to fully classify them manually on all our subjects, but still needs some sort of manual intervention and manual labeling. So if we want to avoid that? OK, there are automated approaches. Perfect. Did they work? Let me check. Let's compare it with manual classification. So no way. At some point, we need to look at the data, as all the other speakers talk about. We need to be able to classify them into signal and noise, even just to check that the approaches we chose is actually effective. And apparently, it's even more complicated than that, because we need an expert to do that, apparently. But who is the expert? Well, maybe in other fields, the expert is more clear to spot, is more evident. In our case, the expert look more like this. The point is that there's no absolute ground truth on what is signal and what is noise. And above all, there's very little literature about how to classify the components, what to look at to decide what is signal and what is noise. So rather than the expert, we need a consensus. We need to come up with a set of rules, even just guidelines, to all agree on what is signal, what is noise, and to make studies more comparable and more reproducible. So that's why I'm going to focus on trying to find this consensus. Okay, so regarding the theoretical characteristics of signal and noise, the literature is quite consistent. So there are some features, both spatial and temporal, that enables us to distinguish signal and noise. So here I summarized very quickly, but regarding the spatial features, we can look at the number of clusters and their dimension. And in signal components, we will have a low number of big clusters. In noise components, a big number of small clusters. Then if we look at the overlap of the spatial pattern with gray matter, signal components will overlap nicely with the gray matter. Noise components will probably overlap more with white matter, CSF, blood vessels, overlap with brain boundaries, edges of the field of view, and be localized also near the sinuses where we have signal drop due to air-tissue interface. Regarding the spatial features, a signal component will have a fairly regular oscillatory time course, will be, if we are talking about task fMRI, will be correlated with our task, some of them, while noise components will probably have large jumps. Regarding the power spectrum, usually most of the signal is located at the lower frequency, while we might have more high-frequency noise. And also, noise components related to motion will probably correlate with our realignment parameters. So that's all nice and easy. Let's put everything in practice. So this is a question for you. This is a component, spatial map on the top, time series on the bottom left, power spectrum on the bottom right. The blobs in red are positive blobs. The negative blobs are shown in blue. Who thinks this is signal? Who thinks this is noise? Very good. This is signal component, default mode network. We're all good. We'll keep this in the data. Second one, who thinks this is signal? Who thinks this is noise? Very good. Okay, motion-related component, ring around the edge of the brain, sawtooth pattern, high-frequency power spectrum. Third one. Who thinks this is signal? Who thinks this is noise? That's the problem. So it's not all that easy. And even if we have the theoretical guidelines, it's not that easy anyway. So let's leave it here for the moment. I will show you a few more examples, and we will come back to this. OK, this is another signal component from a high-resolution data set without spatial smoothing. So even if we have a high number of small clusters, we still can see that the pattern, especially underlaid with the underlay of a T1 weighted image, so high-resolution anatomical image, and looking at different planes, we can see that we have a nice pattern that follows the gray matter. The time series is nice and smooth, and the power spectrum is low frequency. So this is still a signal component. This is a motion-related artifact, similar to the second example I showed you before, this time in a low-resolution data set. Again, we can see the rings around the brain. Another good way to spot a motion-related component is to look at realignment parameters. And we can see that the jump that we have in the time series is in correspondence to a sudden head movement. For physiological noise components, we need to have in mind how the vessels are organized in the brain, at least the main vessels, the main veins on the left and the main arteries on the right. This is because this is a component that is relative to veins. You would definitely not say that from this view, and that's why it's really important to change the view and change and underlay a high-resolution anatomical image. In the top right panel, I lowered the threshold, and in the right bottom panel, I smoothed the component, not the data, just the component for visualization. And in this way, you can see that now the spatial pattern nicely follow the sagittal sinus. In this case, we have a low frequency power spectrum because the veins have not usually quite high frequency, or at least it also depends from your TR. Similarly, this is a component that is relative to arteries. Again, not that clear from this picture, but again, anatomical imaging as underlay. This time we should increase the threshold so that we can see that the peaks are in the vessels, and what it could be interpreted as an activation or a functional connectivity ball signal from the insula is actually coming from the medial arteries. In this case, also, the power spectrum helps because this time it's high frequency. Similarly, this is a component related to CSF pulsation. And again, playing a little bit with the threshold and the planes, we can see that the spatial map overlaps the third and fourth ventricle. Again, power spectrum is high frequency. This is a nice component overlapping clearly the white matter, although if we look at the same component in a high-resolution dataset not smoothed, you can see that the pattern is actually more at the edges between the white matter and the ventricles. This could be either due to partial voluming, but also another hypothesis that we have is that it comes from probably the microvasculature at the edges between ventricles and the white matter. Still physiological noise somehow. Going to MRI-related components, this is a component relative to susceptibility, signal drop in the areas near the sinuses. In this case, the most useful underlay for evaluating these components is the EPI itself, because this is the modality where we have signal drop. So we can check that the areas where we have signal drop in the EPI are the ones that show up in the pattern. This is a component related to a combination of motion and multiband artifact. For those of you who are not familiar with multiband, it is an acceleration technique that allows us to acquire multiple slices at the same time. In this case, the multiband factor is 8, and it means that we were acquiring 8 slices at the same time. And this is shown because you have the spatial pattern every 8th slice. This results in a nice checkerboard on the axial plane and some stripy pattern in the other 2 planes. And this is often combined with motion. And in fact, as you can see, the jumps in the time series correspond to sudden half movements. This is another generic noise. What I mean by generic is because we have high number of small clusters. If we decrease the threshold, like in the top, we don't really see any cluster following the gray matter. If we increase the thresholds, the peaks are somewhere inside, sometimes outside the brain. We have a sawtooth pattern in the time series and high frequency spectrum. In this case, we tick all the boxes of the features of noise components, but we don't really know what's causing it. We can't really tell. But again, in this case, we would throw it away and say that this is basically noise. OK, let's go back to this. After all this range of components, who thinks this is signal now? Who thinks this is noise? Same results. It's still not that easy. So following the same kind of analysis that I did for the other examples, if we look at the spatial map, we have both large and small clusters. Most of the large positive clusters are in the gray matter. They are symmetrical. They could be referred to the temporoparietal network, one of the resting state networks. But then if you look at the blue big clusters, they are in areas of signal drop. Time series is fairly regular apart from those 3 jumps between 100 and 150 seconds. The power spectrum is mainly low frequency, but it has a little bit of power in the high frequency. So as Molly was saying before, we don't want to throw away signal. So the rule of thumb is, unless we are sure that this is noise, we would keep this in the data. But still, it's unknown. It's a mix, probably, of signal and noise. But at this, the take-home message is, if you're not sure, don't throw it away. OK, so these are some of the tips that I've shown you while presenting the examples. What I didn't really say, for lack of time, is to look at both positive and negative clusters, because most ICA algorithms will try to maximize positive values, but not always. And because ICA is a linear process, the sign flip, it doesn't really matter. So if you have a nice default mode network with all negative values, it's fine. You keep it in the data. A lot of people prefer to look at components in surface space. This is good if you have high-resolution data and if you did all your pre-processing in surface space. If you did it in volumetric space, or if your resolution is low and you are just projecting the data onto the surface, it probably doesn't add much value. In general, expect a high proportion of noise components over signal components. Usually, I would say even 80% of more of the components you would extract are motion. Not motion, but noise in general. We should set priorities. What I tried to do, showing you the examples, is to look first at the spatial map. That's probably the most important thing that needs to somehow make sense. Then we check the time series, and then we check the power spectrum. But again, the main aim is to retain as much signal as possible. So we should adopt an innocent until proven guilty criterion. Again, there is no hard rule, no ground truth. We might end up in multiple loops checking the same component over and over again, over days and days, asking a colleague and so on and so forth. But that's the best we can do. As long as we are consistent, and I agree with my colleagues, describe what you do. And you can all be experts, don't worry. OK, so, but what if we really want to help? We don't want to do it manually. Well, first of all, get yourself a good visualization tool. The example I've shown you today, they are from Fossilize, which is the new viewer from FSL, or anything that will allow you to have all the pieces of information together. So spatial map, time series, power spectrum. You want to be play with the threshold, want to be play with the planes, and so on. I didn't talk about any particular measure of the amount of overlap or of the fraction of the power spectrum in a specific frequency band, or about identifying spikes or outliers. It's something that you could do, and you can extract it from your data to help you classifying signal and noise. But the problem is that there are probably not going to be a threshold that can be applicable for all the data set that you have. So if you want some numbers, that's helpful, but it's going to be probably variable from data set to data set. A good way of visualizing these features is the one proposed by De Martina and colleagues. They called it IC fingerprints. So they calculated some of these features and plotted them so that you can have a different way of looking at the data, and that could help identifying signal and noise components. And what about automated tools? Well, there are many automated approaches that mainly differ in terms of how many features they extract from the data, which classifier type they use, and if they require a training dataset or not. For being very practical, I only listed here the ones that you can download with a click, install, and use. But there are many papers using different approaches and showing their methods, so you can apply as many approaches as you want. And then I want to talk about the fact that all we do with the data, from acquisition to ICA decomposition, will impact the characteristics of our components. So from the acquisition stage, as I showed you from different examples, the resolution, both temporal and spatial, will affect the number of components and the quality of your components. You will have scanner/sequence-specific artifacts. I showed you multiband, and as other colleagues talk about, if you have a long or short TR, you will be able to resolve up to a certain frequency. So you need to know your acquisition parameters so that you can relate specific artifacts to some of your imaging parameters. Again, there's the multi-echo option, and I will leave up to the last speaker to talk more about it. But you can apply ICA to multi-echo data, and in principle, the guidelines or how the artifacts look like can be applied to multi-echo data as well. Regarding the pre-processing, I've shown you some data that were spatially smoothed, some other data set that were not. This is a choice that is not supposed to be based on the cleaning procedure. You decide your own pre-processing step, but bear in mind that if you don't smooth the data, you will have probably a more speckled pattern. If you smooth the data, you will have a smoother pattern. You might want to smooth just the components and not the data, just for visualization purpose, not to go ahead with the processing itself, but just to have a different view of the components. And also, even if we don't require any recording or anything, it doesn't mean that we can't combine ICA-based cleaning with other, for example, including the physiological recordings when we clean the data. Also, like all the other approaches, it will probably, it will for sure depend from your population. So you will get probably different components and different amount of components if you have patients with specific alterations, especially those with either neuronal activation, alterations or vascular alterations. You will probably get more or less motion-related components. And also, obviously, if you're doing task fMRI, you will probably hopefully get task-specific components. And briefly, a couple of examples on the effect of ICA-based cleaning. In this study, so one effect of the ICA-based cleaning that is performed at single subject level is that when you go on a group analysis and you perform a group ICA, you will get better components. And better in a sense that, first of all, you will get a higher number of good components. As you can see here, there is a data set that has not been cleaned, and 25 group components were extracted. The components in green are the good ones, the resting state network ones. The red components are the noisy ones that are present in the data. If we clean them with an ICA-based approach, in this case fix, and we extract the same number of components, you will see that the number of artifactual components that are still in the data is much less. And also, it's not a matter of just the number of good components, but also the quality. So this is an example of a group component extracted from the Human Connectome project before and after cleaning. As you can see, it's still a resting state network, still a sensory motor network, but it's much cleaner, and the Z value is much stronger after cleaning. And also, one application in a patient population, this study was comparing healthy controls and patients with Parkinson's disease. And this was using either just purely motion regression or fix. In this particular case, with a study-specific training data set, so including both patients and controls in the training data set, so that the algorithm has a wider range of example of components to be able to classify the rest. And as you can see in the top row, after motion regression, the difference in the functional connectivity of the basal ganglia network is just about visible, but after a more study-specific cleaning, we get a nice difference in the basal ganglia network, as we would expect from this population. And yeah, that's all I have to say for now. Thank you very much, and happy to take questions.
Okay, thanks very much, Ludo. Any questions? Go ahead.
Yeah, thanks for the good talk. I've got a question. So let's say that you've done some form of ICA or some form of artifact removal using ICA, and let's say that an expert has identified what they believe are motion-related components or something of the sort. and you've removed those and you've reconstructed the data. Now, when you get to later steps, do you still do some form of, say, censoring of the data based on movement parameters or regression of movement parameters or other forms of regression after that step? I think ICA's looks to be very promising at removing, sort of non-specific, maybe neural fluctuations in bold. But I'm curious if there's still that uncertainty that you have that you still would want to use some form of regression of movement parameters or censoring.
Yeah. So in general, it can be combined with other types of cleaning. Usually, one approach that, for example, Fix incorporates is the possibility of including the motion parameters at the stage of removing also the noise components. So that's one thing that is routinely or like almost by default done. The point is that it is done after ICA decomposition, so basically including the motion regressor in the GLM while removing also the noise components. In general, I would say that any additional cleaning, it's probably apart from censoring, which it's probably going to affect the components. So maybe if it's a really bad data set, you might want to do censoring before so that you get reasonable components. Other than that, if you want to include physiological recordings, you should probably do it afterwards, because the idea is that if you remove them before running ICA, if there is still some residual physiological noise in the data, it might not be popped up by the ICA because it doesn't have enough variance explained to show up in the components. While the other way around, if you remove the physiologically related components, as you see, and then you further remove the physiological noise, theoretically, if you already removed all of the physiological contribution, regressing out a little bit more should not be a problem, because the contribution would be less, so you will remove less. That's as a rule of thumb, I guess.
Okay, next question.
Hi, just a quick question. Typically when you do fMRI experiments, you run like several scans for 10 minutes each. Would you recommend running ICA separately or like on a concatenated time series?
Because it's done at single subject level, I would, so as long as you do the same type of ICA-based cleaning, so maybe if it's with a training data set, using the same training data set for all the scans, but I would concatenate them afterwards. So running separately for each session and then do all the rest of your
So you'd run ICA on each scan separately?
Yeah.
Okay, thanks.
Okay, thank you for presentation. I use Fix, I love it. And I am supposed to be the expert that do the manual classification to train Fix. Sometimes I have a feeling that, so as the component that you showed before, well, it was not clear to decide. It was, I have a feeling that in that component there are both cognitive-related and noise-related signal. In other words, I think the problem is related to melodic, that was not able to separate the noise and the signal in two different components. Do you agree with that?
Yes, definitely. I mean, the other idea would be, so usually we would recommend just to use ICA with automatic dimensionality estimation, also because it's kind of consistent in terms of it will pop up more components if it needs to. But I agree that some of them are mixed. I mean, we could like rerun ICA imposing, like forcing to extract more components and hoping that that component would split. But the point is that at which cost? So since it's quite early in the pre-processing, I would rather keep it in the data, definitely, and then probably the residuals of that noise will either pop up in the group components, so will be summed up from all of the scans, or, yeah, I mean, it's a reasonable question, but I would say it's usually probably not that worth it.
Okay, last quick one.
Related question. So increasing the number of components, did you find that you find those mixed signals and noise split? when you increase the number of components that are estimated?
So I never tried it myself, like empirically. To me, I would rather play with the dimensionality of the components at group level to get to separate out the components I'm more interested in, the areas I'm interested in. At single subject level, I don't think it would enhance a lot the efficiency of the cleaning methods, but I never tested it myself, so that's my just gut feeling.
Okay. Yeah, I found that they tend to split a little bit, but still kind of preliminary results.
Okay. Ah,
you.
interesting to know that.